Okay, so Johnny on the channel asked that please do a video about human metapneumovirus, what precautions we take and how it affects the health. So because this virus is in the news for last 3-4 days, so I thought of reading the literature and give you a brief info about this virus. So what is there actually on the records. So basically this virus is not a new one. It has been there for last 60 years. It has been causing infection for last 60 years, but it was first detected in somewhere in 2001 in Netherlands, where they've identified a new type of virus which is usually affecting the children's. So it is classified as a in the Pneumoviridae family as a large enveloped negative sense RNA virus. And now after 2016 it is reclassified as metapneumovirus, and it has been separated as the related one, which is orthopneumovirus, in which RSV, respiratory syncytial virus, is also present. Now there are various subtypes of this metapneumovirus, human metapneumovirus, HMPV. They are divided into A and B, HMPV A, HMPV B, and they are further divided into A1, A2, B1, B2. There is not much genetic difference among all these. They all can cause diseases, but the point is, whenever there is an outbreak occurs or a seasonal thing happens, usually one of the strains remains prevalent, particularly in that season. So all of them don't affect simultaneously. Usually one strain is predominant in a particular season. Then how pathogenesis, how it infects. So basically it's a respiratory virus. It affects the respiratory system. So it affects the integrin alpha 5 beta 1, has been identified as a receptor that facilitates infection of the epithelial cells. And once it affects the epithelial cells of the respiratory system, then it causes mucus hyperproduction and hyperplasia of the respiratory epithelium. And when there is a hyperproduction of mucus and there is a respiratory hyperplasia, there obviously will have airway obstruction and hyperresponsiveness, and that's why it can aggravate asthma also. So that's the pathophysiology. How it is transmitted? It is transmitted from humans to humans. It can transmit from human to humans. How it will be? As with other viral infection, it will transmit through droplets, aerosols, fomites, but not small aerosols. So if we keep it some 6 or more feet distance away from the infected persons, the chances of getting the infections becomes very, very less. So that's the thing. Nosocomial infections, yes, it can occur because if the patient is affected, we don't know the attendant is also affected, and once the patient is affected, that attendant may not show symptom at the time, or the healthcare professional may not show the symptoms at that time, and then it can spread like at every respiratory virus. So better to isolate or cohort such patients in a different sort of or different beds like that. If possible, treat them in private rooms, or if in ICU, then cohort the patients. Now how is the incubation period? So from the start of infection, suppose a person get infected, so 5 to 7 days is the incubation period, after which the patient start developing the symptoms, and that's the time, means 5 to 7 days is the peak time of viral shedding. So at this stage the patient is transmitting the virus at the peak, and once the symptoms start, then it is a self-limiting disease, and gradually the symptoms resolves over a period, next period of 3 to 5 days the symptoms resolves. So this is thing. Epidemiology, I already discussed with you that it is prevalent everywhere. It is prevalent ubiquitous, means in Netherlands, United Kingdom, Finland, Australia, Canada, Kenya, China, Norway, and many other countries. So this is nothing new. It is there for life. In fact, in 2018, 14.2 million cases were there in the children less than 5 years of age. So it's a common thing. Now it affects all age groups, specifically in the children's less than 5 years of age, and the people who are very older age, or those who have a chronic illness like COPD, or where they are fragile, or have a transplant patients, or those who have immunocompromised patients like that. One seasonal variation, it is written here that it occurs like in United States or those sort of Western world countries, it occurs in the late winter and early spring, while in this part of the country like Hong Kong or China, it occurs in the late spring and in summer season. So that's why it is in late spring summer season it can occur. Their cross reactivity is with RSV virus, respiratory syncytial virus. So if somebody got infected with RSV, there is a partial immunity against this virus, and RSV is also very common. Now, when it affects the children and when it affects the adults. So usually the children is the first time they get affected, and it's a self-limiting disease. So what is the symptoms they will develop? Usually they have a symptoms of cough, rhinitis, and fever. But wheeze is classical, means whenever this virus affects, the wheeze is disproportionate as seen with other viral infections. Even in adults, when they infect, means older patients or adults in which there is a reinfection, the symptoms will be cough, nasal congestion, rhinorrhea, dyspnea, hoarseness, and wheezing. And the wheezing even persists in such patients for a longer period of time also. Means even the symptoms have resolved, the wheeze persists for a longer period of time. Some studies or some literature is showing that it may be associated with the development of asthma later on, but they are not confirmed sort of reports. So all the upper respiratory tract infections manifestations are there, and also the lower respiratory tract infection like cough and the wheezing are there. Dyspnea can also be present. Then what is the spectrum? It can cause upper respiratory tract infection, it can cause lower respiratory tract infection, it can cause bronchiolitis, it can cause severe pneumonia, it can cause ARDS, but the incidence is very, very low. In rare case scenario, it can cause encephalitis also. The risk factor for children is those who are prematurely born in particular area, or female sex, or the phenotype or genotype of B, B1, B2 are more prone to children. So this was about the symptoms. COPD exacerbations are not very much related to this virus, but asthma exacerbation can occur. Recurrent infection, yes, once you have this infection, it can occur later on. Like in children, it has happened. Adults, also it can happen. All adult infections are usually the reinfection, because most of them have infection in the childhood. In immunocompromised hosts, the peculiar one at risk are transplant patients and those who have received hematopoietic cell transplant patients. The little bit more incident in HIV infected patients, or severity is little high. Then hematologic malignancies patient, lung transplant or patient with malignancy, these have, for obvious reason, a little more chances of getting infected. Now, once you have a patient with these symptoms, viral sort of fever, you find wheeze also. So what are the tests which will help this? So diagnosis is by RT-PCR, just like we did for COVID, or for that matter, for this also, there is an RT-PCR available in some labs. In some labs may not be present, but RT-PCR is the standard thing. Some multiplex PCR in which there is a viral panel and they do a lots of virus testing there. In multiplex PCR also they test it. So, but other than serology or viral cultures and are not very useful. They are only for research purpose. So RT-PCR and multiplex PCR, if available, can help you in making the diagnosis. No specific thing in CBC counts, obviously, but there can be leukopenia per se. Treatment supportive. There is no proven medication which can help you out. Just supportive medications we should give. We should try, and all the how can we prevent? All the taking precaution, infection control, prevention measures, hand washing, covering the face, wearing mask, proper distance. One important thing is, if the kids are infected in a family, then the old peoples or those who have comorbid conditions should avoid playing with the kids or interacting with the kids for at least period of 9 to 10 days, 8 to 10 days. So nothing specific in the treatment, all supportive treatment which we give in other viral infections also, the same applies here also. No vaccine is available at the moment, but on and all, while going through all the literature, found that this is a common virus. It happens almost every year. Outbreaks are common because it spreads like any other virus in a community. So do read more about this virus and don't be fearful. If it is occurring, the healthcare professional will take care of. So better equipped with yourself with the correct information from authentic resources, and do read more about it. Thank you.